Stop doing endless tib raises to get out of knee pain. In this video, I'm gonna show you the best exercises you could do to solve your knee problem. What's going on, guys? Dr. Nippon Forte back here again to talk all about the knee in this video. Now, tib raises, are they completely bad? Of course not. But the thing is, I'm sure you've seen it if you're trying to get out of knee pain, do tib raises all day, get your anterior tibs strong, and your knee will miraculously get better. When in reality, when you zoom out, a lot of knee problems, it's a lot more complex than that. And when we're dealing with a lot of knee problems, specifically the knee, we gotta look above and below the joint. We have to look at the ankle, down below, and above at the hip. A lot of times, more commonly than just doing tib raises to strengthen your anterior tib, above and below the problem of the knee are actually the areas that you have to address to then ultimately help your knee function and feel a lot better. So one of the most common problems we see with the knee is patellar tendonitis, or the pain right below your kneecap. Technically, this is a ligament because it's bone to bone, but commonly it's just referred to as patellar tendonitis. But it's a ligament, not a tendon. But that's a whole different story. So in this case, we're gonna be focusing on addressing knee problems above the chain at the hip. So remember, a lot of knee problems are from above and below. In this case, we're gonna focus on all of the hip and how it can relate down the chain and lead to some compensations at the knee, like patellar tendonitis. So that's the main purpose of this video. Now, when we think about the hip being a contributing factor to the knee, we have to think about what is actually going on at the hip. We have many different muscles at the hip. Specifically, we know the glute muscles, but there's different components of the glute muscle. We have the glute max, the glute medius, and the glute minimus, and then we have deep external rotators of the hip, are all important from the tissue at the hip going into the hip bone, which is primarily for stabilization, force production here. But if there's weakness and stuff to this area of the hip, it can lead down the chain, cause abnormal mechanics here, and contribute to, for an example, patellar tendonitis, a common issue. So we're gonna be addressing this from a hip stabilization and strength standpoint in this video. The deep hip external rotators play a huge role at hip stabilization. They're primarily stabilizing the hip in a rotational plane because they produce hip external rotation. Now, a lot of times these smaller stabilizing muscles are less strong and weak, and it can contribute to a lot of hip strength problems, which leads down the chain to compensations at the knee. So the knee takes the brunt of everything. So if we're on one leg, the deep hip external rotators help stabilize that. If they're weak, it will cave inward or contribute to caving inward. So we have to create that low level activation and strength to keep it in a stabilizing factor. And we can hit it with a simple exercise like the side lying hip external rotation exercise. That looks like something like this, where we're here on our side like this. We could be on the edge of a table, we could be lying down. Now, the more that you're upright, the harder this will actually be. So the idea is we just want to rotate the leg up like this, and you can hold. And when you do this, you are creating hip external rotation, and when you create a hold to it, you're putting more time under tension to these muscles. Now, it won't take a lot to actually start to feel the hip working. The idea is to think about rotation at the hip versus just bringing your leg up like this. Because if you bring your leg up like this, you'll feel a lot of your inner groin working. You want to literally think about the hip, the whole leg rotating. That will help bias those hip external rotators. When you do this, it will really get at those low-level stabilizers in this case. Now from here, if I'm in this position, it's a lot harder to bring my leg up and I feel my hip fatiguing versus if I was laying down. If I'm laying down and I'm performing the same type of movement, it'll be a lot easier here because I'm out of a range of motion. Versus when I get further into a range of motion like this, it creates more demands on the hip and it could fatigue the muscle a lot more. So again, you're here like this, you wanna stay stiff where you're not slouching or anything, and you're just gonna rotate the leg up and you could hold. I like to hold initially, say 5-second holds, 8 reps, and you could do multiple sets. The idea is you're getting an endurance component to this to hit those deep hip external rotators, and at the same time, you're working and improving the active control into hip external rotation. So it's twofold. It will help mobility at the hip, but more importantly, it will help the active mobility, which plays a role into the active strength, so that when you're on one leg, you get more stability at the hip versus having those weaker hip external rotators that contribute to these dysfunctions down the chain, such as at the knee. Now, keep in mind some also progressions to this too. It doesn't take a lot to actually feel fatigued when you're doing this if you're doing it correctly. But progressions are simple ankle weights that you can do the same exact motion to. And if you put an ankle weight, say 5 pounds on the ankle, and you try to rep out, the reps that you might think you get to will be a lot less than you could actually get to before the hip starts to be really fatigued. It doesn't take a lot because you're trying to bias those particular muscles, which tend to get essentially overlooked because we do higher level things that don't target that area. So try this one out and you should be a crusher to those hips. Now for the hip muscles, we also want to help bias the lateral plane for stabilization. When we're on one leg, there's many motions that we're kind of stabilizing in. We're stabilizing in the rotational plane. We're stabilizing in the lateral plane. These two motions tend to get overlooked. So hitting the lateral plane, which helps us stabilize on one leg, so we don't deviate inward and contribute to some compensations at the knee, we have to work on that lateral stabilization. A great exercise you could do is the side plank clamshell for this exercise. That will get at that lateral stabilization. Now from here, you're gonna be on your side, knees are gonna be together at first, and your hip is almost at a 45-degree angle. If this would be 90, you wanna be at a 45-degree angle, and your ankles or your heels stay together. Now the key is with this, when you go up into the plank position, you're gonna be opening up, but at the same time, you wanna think about thrusting your hips forward because it's a 2-for-1. You get at the lateral stabilization, but you also get at hip extension when you go forward, which creates more activation to the glute areas. So, or the hip stabilizing muscles in the whole general aspect of the hip. You're getting a 2-for-1 with this exercise. So when you go up, I'm thinking about bringing my hips forward, and then I'm gonna open up and hold this position versus staying backwards like this and opening up. So you wanna go up, thrust your hips forward, and then open up, and you would hold this position. I like to hold this position in the beginning phases for durations. 10-second holds, 6 reps. That's a minute of time under tension. You do 3 rounds, that's 3 minutes. More input, the better, especially in the beginning phases, to really get this stuff awake and activated. So from here, you go up, thrust your hips forward, open up and hold. Now from here, you're gonna feel the downside hip working a lot more than the top side hip. This is the stabilizing hip in this case, and then you come back down. So you'll notice when I come back down, I'm kind of shifting my weight backwards, and then when I come up, I'm shifting my weight forward. Okay, so forward, open up, and hold, really thinking of driving that knee down through the table to really stabilize the hip muscles on the outside of the leg. And you come back down and you repeat. Now, of course, you can add progressions to this by adding a band around the knees. You could hold a weight on top of you, but the idea is not to just rush through this simple looking exercise. It's to do it correctly, because when you do it correctly, you get more biased work to the hip region. We also want to consider the opposite rotational motion at the hip, which is hip internal rotation. So we worked on hip external rotation, but we want to go work on the opposite side. So they're getting at different parts. Now, what brings the hip into hip internal rotation? It's variations and fibers of different muscles. There's fibers of the glute medius that contribute to this. There's fibers of the TFL, the tensor fascia lata muscle, that create hip internal rotation. A lot of times, these fibers of the aspects of these muscles are less strong. So we want to activate that. A simple exercise you could do is get a yoga block in between your knees. From here, you're on your side. You want to squeeze the yoga block, and then, which stabilizes the pelvis and the legs, and then you raise the top side heel up as far as you can into moving into hip internal rotation. So when I do this, you'll feel the top of your hip burning and like it wants to cramp. That's a good sign because you're working into ranges of motion that you might not have, and you're activating and getting strong in those ranges of motion. It's lower level, so we're help biasing these smaller aspects and differentiations of the muscle to really help improve its strength. Now the key with this is to really help bias this, we want to start at a lower level versus just adding an ankle weight or a band to the legs to actually challenge this. Start with your body weight to see where you're at and how it feels, and then you could progress to maybe an ankle weight or a band. But you'd be very surprised that just doing this with body weight, you'll feel the top side hip burning and really working. Again, with this exercise, I like to start with duration, time under tension. So for an example, really try to fight for more range of motion, hold it for 10 seconds, and then come back down. You repeat, say, 6 reps. That's a minute of time under tension. You do 3 rounds, that's 3 minutes. That's a lot more work being done than just repping out 1, 2, 3, 4, and it's just barely any time under tension. So you want to work time under tension with these smaller muscles to really get at more input to the system before you start progressing with bands or an ankle weight. Also keep in mind when you go up, you want to focus on compensations at the pelvis. When you go up, you don't want to just dump your pelvis forward like this. I'm exaggerating a little bit, but it's a compensation to get up higher. You want to squeeze the yoga block, stay stiff in the abs, stabilize, and just move at the hip versus compensating at the pelvis. So focus mind-body connection on that to really get more biased work to the hip. So to recap, in this video, we hit 3 different exercises that are all targeted to the hip for more hip strength and stabilization. And in this video, we focus primarily on 2 ranges of motion, the lateral plane and the rotational plane of motion. 2 ranges of motion or 2 planes of motion that really get undervalued and overlooked because we're focusing on the big movements. The squat, which is the sagittal plane motion. Nothing wrong with that, but these other planes of motion tend to get overlooked, and a lot of times we have to hit those planes of motion with exercises like the ones reviewed in this video to really get at the hip stabilizing muscles a little bit more effectively and help bias them from a strength standpoint and an activation standpoint. I hope you did find value in this video, and if you did, to support my channel, I would greatly appreciate it if you smash that subscribe button down below, like this video, comment in the comment section your favorite exercise you liked out of this, and I really do hope it was helpful and you learned some things throughout this process. This is Dr. Nick. I'll see you next time.